My name is Harrison Farber, and I'm a neurosurgeon at Carolina Neurosurgery and Spine Associates. I've worked here since 2024. Cervical disc replacement surgery is a procedure where we replace a degenerated disc in the cervical spine and the neck with a type of implant. The goal of the surgery is to typically remove pressure on either the nerves or the spinal cord itself by removing the worn out or degenerated disc, which is the cushion between the vertebrae or the bones in your neck. We replace that with an implant that allows you to maintain the normal motion between those two bones that you had before surgery. Patients will need this surgery for a variety of reasons. Often there is some sort of process that has caused the disc space to wear out. In that case, there is usually pressure either on the spinal cord itself or on the nerves that causes the patient to have symptoms, which could consist of neck pain, arm pain, numbness or tingling, weakness, or even affect their overall function of their body. When that happens, the degenerated disc needs to be removed and it has to be replaced post-operatively. The two main approaches for this are to perform a spinal fusion, where a cage is placed in the disc space between the bones. Alternatively, a arthroplasty device may be used. In both scenarios, the nerves or the spinal cord are decompressed. The goal of the arthroplasty procedure or the disc replacement procedure is to maintain that normal range of motion even after the surgery is performed. While cervical fusion is a great procedure and is known to have very good outcomes, in the long term, studies have shown that fusing two joints of the cervical spine can lead to extra stress on the other joints in the cervical spine, and therefore 5, 10, 20 years in the future, some patients will require another surgery due to degeneration of those other joints. There's a lot of research now suggesting that cervical disc replacement avoids that risk of needing that other surgery at these other levels because you're maintaining the normal range of motion. Recovery from a cervical disc replacement is very similar to that of a spinal fusion. One key difference is that there would be no collar or bracing needed after surgery. We would actually encourage range of motion of the neck following the surgery. A few days after surgery, you may notice a sore throat from the approach to the anterior part of the neck, but this is typically self-resolving in a short time. Patients are often able to return to work and normal activity within several weeks following the surgery. Long-term success following cervical disc replacement involves improvement in the patient's preoperative symptoms, whether that be neck pain or arm pain or other loss of function that they may have had before surgery, while also maintaining their normal range of motion so that they do not later describe increased neck stiffness or difficulty with mobility.